Great, thanks everybody. So welcome everyone from across the globe to the second webinar in this Social Protection Responses to COVID-19 series. Today we're going to be looking at how can social protection systems respond to the COVID-19 crisis. We have presenters today in Europe and the US, and I'm in Australia. I'm Lisa Hannigan, the Director of Social Protection for the Department of Foreign Affairs and Trade, and I'll be your moderator today. This is the second webinar of the Social Protection Responses to COVID-19 webinar series. The series is a joint effort initiated by IPC-IG, GIZ, on behalf of the German Federal Ministry of Economic Development and Cooperation, and my department, the Department of Foreign Affairs and Trade. This is in collaboration, of course, with socialprotection.org platform and in cooperation with partners from different organizations. The webinar series is part of an initiative with two other major components. There's a mapping of news and documents disseminated weekly through a newsletter. And there's also an online community on the topic, and you can join the online community, which is Social Protection Responses to COVID-19, to learn more about the whole initiative, to find ways to collaborate and keep updated about future webinars. So now I've been working on social protection for many years now, and I have never seen this much interest in it. Most countries with a social protection system are in the process of expanding it or thinking through whether they should expand it. And if they don't have a social protection system, they're wondering what their options are. So today we've got this great opportunity to hear from people who have been thinking about social protection and shocks for a long time. They'll share their wisdom, but you'll also have the opportunity to ask curly questions at the end if they haven't addressed any key issues that you're interested in. This webinar today intends to present a comprehensive framework to explore how countries are using their existing social protection systems to address COVID-19. We also want to use this webinar to set a framework for upcoming webinars within this series that will dig into different themes and bring in more country experiences. The next webinar in the series will happen this Thursday and will focus on social protection and healthcare in lower and middle income countries, exploring how governments and partners are responding to the risks and the challenges faced by older people in the context of COVID-19. And this coming week, we'll have two more webinars that will focus on G2P payments in the COVID-19 context, exploring experiences from country emergency actions, and on linking social protection systems to humanitarian cash in a pandemic. But as I mentioned before, there will be time for questions, so please do think about what you'd like to ask during the presentations and send your questions through. We will do our best to address all of the questions during the Q&A section at the end of the webinar, but because we've got over 800 people registered for this webinar today, it mightn't be feasible, so we will prepare a Q&A written document to be shared with the audience and to be published with the webinar summary. This will be available on socialprotection.org some days after the webinar. And we also need to remember that there will be other webinars, and so sometimes things won't be answered here, but will be answered in future ones. And if you do join the Social Protection Responses to COVID-19 online community, you can also participate in the follow-up discussions about the webinar. Now let's get started. I'd firstly like to introduce our amazing panelists to you. We have two presenters today, Valentina Barker. So Valentina is a consultant focusing on social protection delivery systems. She's done a lot of work, including with DFAT, on information systems and shock responsive social protection, and you can see more of her biography there on the screen. Our second presenter is Dr. Michael Sampson. Michael is the Research Director of the Economic Policy Research Institute, EPRI, which is a global research institute based in Cape Town, South Africa. And as you can see from his biography on the screen, he has deep and broad social protection experience. Many of you would have attended a social protection training course with him. He is a brilliant trainer. He's also on the economics faculty at Williams College Center for Development Economics in the US. So we also have one discussant, Dr. Christoph Struppert. So Christoph is a senior researcher in the program of Sustainable Economic and Social Development at the German Development Institute. He works on social protection, health, and applied economics, and has projects in Asia and Africa. He advises the German government on health and social protection, so we can assume he's very busy at the moment. Before joining the German Development Institute, he has a depth of experience in economics and health that you can see on your screen there. So in terms of the agenda today, we have 90 minutes. I'm going to stop speaking shortly, and then we'll have 2 presentations from Valentina and Michael that will go for about 40 minutes. We'll then have 10 to 15 minutes of comments from our discussant, Christoph. And then the floor is yours. You send through your questions and I'll pose them to the speakers. We're hoping we'll have 20 minutes for this at the end, but that's up to our presenters, keeping on time. So now we'll go to the presentations. First up, we have Valentina. Valentina is sitting in Italy, and there is a slight chance her internet might go down midway. And if that happens, we have a backup, Rodolfo Beasley, who has worked on this presentation with her. So hopefully, if that happens, there will be a seamless transition. So in Valentina's presentation, she's going to very briefly explain why social protection can play an important role to support the COVID response. She will frame how this can be achieved, including country examples to date, while stressing that what can be done really depends on what you have in place at the moment. And finally, she'll dive down into the how, looking at key questions to support decision-making, including the really practical considerations on options like rapid registration, enrollment, payments, those sorts of things. So now I'll hand over to you, Valentina. Thanks very much.
Thank you so much, everyone, for the introduction. Can everyone see my screen? I'm assuming yes. So this is the framing framework for this webinar series, and it was developed together with Rodolfo Beasley and Fabio Vera Soares. And hopefully it will give you a very quick, simple overview of what options we have on our plate right now, and with future webinars exploring particular aspects of this. So in terms of the context, I'm sure everyone has been bombarded with this image of the flattening the medical curve so as not to overwhelm healthcare system capacity. And a lot of us are very quickly realizing the economic and social consequences this has for us all, potentially steepening the recession curve and with long-term economic costs. So there's very much consensus across the board, across all institutions and thinkers who've been discussing this, that we need to act fast and do whatever it takes to avoid the negative consequences of this. So what is so special, what is so different about COVID compared to things and other types of shocks we've seen in the past? On one side, we've got the illness and death issue, typical of any pandemic, and the risk of contagion, the fact that we have to be behaving differently to avoid that contagion. So social distancing in some countries, lockdowns to very different variations. And that has had at an unprecedented speed impacts in terms of income loss and reduction, job insecurity and loss, for many food insecurity for those of us who live hand to mouth with potential threat of famine in some parts of the world, negative coping mechanisms, people having to immediately kind of sell off assets or eat less meals per day, et cetera, in order to face this shock. And with vast sections of populations being affected much more than most other shocks, but also different segments of population compared to typical shocks, and different age groups affected differently in employment sectors, people with different employment types affected differently, rural versus urban. Basically, these are not necessarily our routine social protection recipients. And let's remember in the background that this context of contagion has also got big consequences on service delivery and the delivery of social protection in particular. This visual is just a very slap in the face image to show just the extent of the speed of what is happening. That little glitch that you can see here is the 2008 economic crisis, and this is just 1 week of applicants for unemployment benefits in the US. And if we looked at any other countries with on-demand systems for social protection, you'd see a very similar type of shape right here. So what is the potential role of social protection in this context? Let's try and think through basically what can be done in any given country will depend on what we have in place. And broadly, any social protection system is composed of these 3 core pillars, where you have in gray here your social insurance policies, your sickness and injury leave, your pensions that are contributory, etc., etc. In the middle, we have our social assistance non-contributory programs, which could be operationalized as cash transfers, either poverty targeted or categorical, etc., etc., in-kind transfers, school feeding, etc., social care services, and then this red pillar, the labor market policies interventions, such as employment incentives, wage subsidies, and so on. The reason I'm not going to go into depth on this, this is based on the CODI core diagnostic tool from the Interagency Social Protection Assessment classification. The core concept here is that different countries have different sets of programs in place in order to address the different risks that populations face. But this composition actually looks very different in different countries. And in many middle and low income countries, but also some high income countries, social protection systems are usually fragmented, and they don't give adequate protection to all risks and to all populations. So what we typically see very often is, if we look at the gray, let's remember these colors because they'll be coming back again and again. So our gray social insurance very often is covering those who are better off, who are within the formal sector. We've got our light blue social assistance programs that are often poverty targeted, covering less than 5% of population, and labor market programs also often targeting formal sector. So the problem of this missing middle, with an increasing number of countries developing more categorical programs, categorical cash transfers, school feeding programs, social care services, trying to cut across, but very often actually also not really protecting everybody and being means tested. Or, for example, if we think of a school feeding program only serving poorer areas or children who are poor within given schools. So given this context, we'd want a system that covers all of the risks of our population, whether they're idiosyncratic or covariate, and giving us universal coverage in terms of the people who are reached, i.e. you can access the system when you're in need, and also the adequacy of the benefits that you're receiving. But that's often not the case. So this brings us to the topic of shock responsive social protection, and there have been many webinars on this. There's been a lot that's been written on this topic. You might have heard different words also referring to this topic: shock responsive social protection, adaptive social protection, shock sensitive social protection. Here we're letting go of any of the debates around the terminology, because ultimately we're talking about the same concept. We want our social protection systems to be strong enough to be able to comprehensively address people's needs, even when those change. And those might change because of idiosyncratic or covariate shocks, where a lot of us are affected at the same time, such as in this pandemic. And a lot of the literature on shock responsive social protection is actually about preparing for this, so doing all the actions that can be done to strengthen the system so that we're ready in advance. The problem here is that many countries are in an ex-post situation. The shock has happened, what do we do now? So we're going to park the preparedness aspect for now, and we'll be coming back to this in future webinars, and we're going to focus on the what now, considering what we have in country. So there's two core dimensions here that are important. We've got on one side, the first step for any country is making sure that our existing systems, our existing social protection programs don't collapse. We want to maintain routine delivery. We want to be able to continue serving the populations when they are most in need. And this might require some changes to routine design and implementation. So note the word we're using there. We're using the word resilience. Very often we use that for people. Here we're talking about system and program resilience. The second dimension is asking whether there's the potential for those programs to adapt, to flex, so as to cover changed context and needs. And this can either be done via existing programs that you might have in place, or via completely new programs that build on existing systems to the extent possible if these are strong enough. And those could be led by the social protection sector, but also by other sectors and by other government counterparts. So if we frame this visually, some of you will recognize this because it builds on the universal social protection framing. The core is our routine programs still functioning, so that resilience, the importance of them still delivering at this moment of extreme need. And then we have our second aspect, which is that adaptation. How do we, the context has changed, COVID has changed everything for everyone across an enormous number of countries. So how do we ensure that we're reaching everybody who has been affected and cover it in terms of coverage? How do we make sure that we're giving enough, given that many people have completely lost any other form of income? So in terms of adequacy, how do we make sure that we're ensuring comprehensiveness in terms of the different types of risks that people are facing right now, which include health risks, for example, and risks of abuse as another example, as we're confined in our households. So let's use this framework to look across our social protection components and instruments. In terms of our social insurance contributory pillar and our labor market policy intervention, we're grouping these together just to be a bit faster. So think about your contributory pension, your paid sick leave in country that you might have, your unemployment benefits. The first dimension is thinking about how do we make sure they don't collapse. And the considerations that we'll have to make here are around how do we, so countries have already been instituting safety measures. So, for example, providing safety gear to their staff, making sure that the processes themselves are not enhancing the risk of contagion in terms of avoiding registration where people have to queue up or physically go to an office. Surge capacity. From countries that we already have data and information from, we know, for example, the UK has just shifted 10,000 of their staff to be working on the Universal Credit Programme. And some of the resilience aspects might be change in legislation so that these programs can keep on operating in this changed environment. What about adaptation? If we think of adequacy, so giving enough, lots of these programs across different countries, and there's good examples in a recent OECD brief, are giving higher amounts, earlier payments, and waived waiting periods so that people get the cash earlier, or they're paying and giving out support for longer periods. So these are easy tweaks, easy things that can be done to support people more adequately. Coverage is slightly more complicated to extend coverage to more people, but there's already a lot of examples of programs that are enhancing access, so making it more accessible, making programs more accessible by getting rid of certain eligibility requirements, documentation requirements, strengthening their on-demand application, online platforms, etc. Relaxing eligibility, and also importantly here for because we're talking about formal sector, extending to non-standard workers, so workers that weren't covered previously. In terms of comprehensiveness, here we're talking about layering other measures or instituting measures that might have been missing. And I've got a set of examples here on the left. You'll receive this presentation, and also there's going to be a webinar on this, so I'm not going to go into any more detail. What about social assistance? A lot of our countries, we know that less than 10% of population are actually covered adequately by social insurance. So here the framework is exactly the same. Let's zoom in. In terms of resilience, all of the things I already mentioned are absolutely kind of should be left, right, and center of what we're doing in terms of ensuring security and safety. And CALP, the Cash Learning Partnership, and HelpAge, they've started putting out really useful guidelines on that topic. But there's some additional considerations here also in terms of, for example, change of modality. So let's think of our school feeding programs. Schools are closed, children are not receiving that food, and that can have very negative consequences in terms of nutrition. There's a vast number of school feeding programs already that have changed their transfer modality, either for it to be in cash instead of in kind or as a voucher, or actually instituting food distribution to children who were previously receiving. Public works, India, some states in India, Ethiopia have already started waiving the requirement to work, so people can be accessing their cash without having to physically congregate and enhance the risk of contagion. There's also options to adapt public works in different ways, and Michael will be discussing that. Social services, again, if we can't have proximity services, how can we go to people's households to be supporting them, etc. There's also a strong case for waiving existing conditionalities that people can't comply with, and maybe even changing role of conditionalities in terms of staying at home. Adequacy, many of you might have heard from the DFID OPM 2018 framework about vertical expansions, and this is what that is, basically giving higher amounts to people. And these are just a few examples of countries that have already started doing this. This is a quick and easy option to be giving more money to people who are already receiving. The question here is, are those programs actually covering the ones who are most affected by COVID? That might not always be the case. And also, what type of coverage are they enabling us to reach? Because if we have a program that reaches less than 5% of population, that might not be very effective. Countries like Australia, Argentina, etc., even Indonesia have been vertically expanding across multiple programs, and of course that helps to increase adequacy. How do we extend to more people? There's already a lot of examples of countries using existing programs to do so, and extending coverage in lots of very different original ways. And we're going to come back to this in some slides later. And this is the topic of registration, quick registration, etc. But also this can be done via new programs that might be led by the social protection sector or by other sectors, but coordinating with the social protection sector and leveraging systems where possible if they are strong enough. So we've seen examples of this in Peru, Bolivia, etc. And we'll be having a webinar kind of focusing more on this, and I'll be touching a bit more on the operational details of how to do this. In terms of comprehensiveness, given the context of COVID, it definitely makes sense to be layering other measures onto existing programs, and in terms of granting health insurance to those who don't have it, psychosocial support, etc., etc. So these are things that we all should be considering when we think of our options. How do we make a decision? First of all, we need to be thinking about who is actually going to be most affected by the crisis, and what level of current protection do they have. So if this is my 100% of population in my country, what does this look like? And I'm starting with a focus on work. So my formal sector employees, my public sector is probably very protected. Remember the color coding, so the grays and the reds. But let's remember that even some formal sector workers might not be protected, especially in the context of a lot of precarious short-term contracts, 0-hour contracts, etc. Those people, for example, in my country, in Italy, are not protected by current systems. Self-employed are not fully protected by current systems, and this is an important consideration for everybody. But then on the other side of the spectrum, we have our informal, irregular workers, smallholder farmers, etc. Some of them might be protected by social assistance, but what about those who are not? So we need to be thinking through who is protected, who isn't, who is being mostly affected, and how we can reach those different population groups, either via social protection or collaborating and working, coordinating with social protection actors. There's also a second consideration here about impacts on different population groups. So how are the young affected versus older people, and kind of how does the demographic profile fit in there? Lisa said we have a webinar from HelpAge on this topic. Female versus male, kind of the gender dimension, we're going to have a webinar on this as well, and what implications this has for programming in this context. Urban versus rural, a lot of our social assistance programs are primarily rural programs. So what does this mean? Do we have a serious urban gap that needs to be filled? And also majority versus minority populations, whether it's ethnic, religious minorities, but also issues of citizenship. So what about non-citizens, IDPs, refugees, etc. The second kind of core consideration, and of course there's millions here, we're zoning into some key ones, is the strength of existing systems. So what you might recognize here is our kind of some of the components of any given program, or both on the social protection side, but humanitarians will probably recognize this as well. So in terms of what financing is already in place and how could that be expanded to cover additional caseloads, we're going to have a webinar on this. Does the legal and policy framework enable, or do we need to be changing it in any way so that we can work with it going forwards? The governance and the coordination, are we coordinating with the right actors? Are there other people that need to be sitting at the table in this context where we need to be working complementarily? And then we've got our core design features of who we're currently reaching. We've had experts repeat again and again that our standard ways of targeting will not be relevant anymore, but we might be able to build on those to deliver swiftly. But what I really want to focus on here is the right-hand side, our delivery systems. So to deliver existing programs, we've got systems for outreach and registration. We've got systems for enrollment, for payments, for information management. And how can we build on those to quickly register, enroll, and pay potentially additional caseloads? So we've already said that for social protection beneficiaries, whether it's social assistance or social insurance, this discussion is actually quite straightforward, because people, are already registered and enrolled. So we have their data, and if we trust the payment mechanism in place, all we need to do is ensure that it's flexible enough to, for example, give more money to those who already receive. The real crux of the issue here is for those who are not currently receiving. And the question here is, how do we register people swiftly, given that we know that we need to be acting fast? And there's a lot of countries already that have been leveraging existing databases, both on the tax and revenue side, but also existing social registries, municipal registries on, for example, informal workers. And those, where they are trustworthy, where they're fairly up to date, where they have relevant variables within them, they can be used with very simple criteria to be able to inform some quick expansions. And there's already many examples of countries doing that, especially where these registries, of course, are strong and trustworthy and covering quite decent sections of population. Of course, that data may need some revalidation, some gap filling, and that is something that countries have started to work with. In terms of countries where that is not an option, we need to be looking at approaches to swiftly register people. And the consensus is that ideally we'd be avoiding census survey type approaches to registration to avoid face-to-face contagion and contact. And so countries that have been experimenting with innovative approaches, online registration. Brazil has been developing an app to enable those who aren't already in Cadastro Único to access emergency benefits, using other data sources, call centers for those who don't have access to internet, for example. Thailand has created a digital registration system and to try and register informal workers. And my understanding is that 22 million informal workers have already applied just in the past couple of weeks, with the support of worker organizations, etc. And simplified documentation and criteria. What about paying? So if we're working through a tax and revenue database, there is the option of tax relief, but that can be slow and sometimes people don't even notice they receive it. And anyway, we're just talking about formal sector. So the core here is about how to pay people fast. Of course, if we do have their bank details from existing database, or if they do have a bank account, then direct transfers are an option in countries where banks have actually had good distribution across the country. If that method doesn't exist, then new payment methods need to be designed. There's already really innovative practice from Peru and from Argentina on paying people without bank accounts, just using their ID and other forms of identification. There's going to be a webinar on this coming. So this is the full framing, and of course it has gaps, but hopefully it should help you to think through these options of for social protection beneficiaries, easy options for non-beneficiaries, a lot of questions to be asked. But let's remember, it doesn't need to happen through existing programs. We can also just be leveraging existing systems, the people working within social protection, and be doing this externally through, for example, humanitarian actors. So just to conclude, what do we need to be thinking about? We also need to be focusing on outcomes. We need to be ensuring timeliness and simplicity, and obsessing over targeting accuracy is not going to be relevant in this moment. Good enough is much better than perfect. We need to be building on what is already in place and making sure it's not collapsing, but not obsessing that we need to be using an existing program if it's not ready, if it's not strong enough, because that might just need to lead to negative effects. We need to be thinking coherently across all components so that we're comprehensively addressing people's needs, including those who weren't within the system previously, and thinking universally, and coordinating. We don't have to be leading everything through the social protection sector. Let's think about how humanitarian civil society can be supporting us, whether it's for kind of last mile hand holding, making sure a grievance mechanism is in place, supporting strengthening capacity, or whether it's actually them taking the lead but working alongside the social protection sector. And just the last word is, okay, we're acting short term, but let's think medium term. Let's think how we'd like our system to look like in the future, given that right now a lot of us have been caught unprepared. There'd be a lot more to say, but I hope this is a useful framing. Thank you. Over. Oh, I've also got some resources within the presentation that you might want to take a look at. I'm sure you've all seen Ugo Gentilini's and Ian Orton's materials, but there's links here.
Great, thank you so much, Valentina. It was just so useful and practical. I love the focus on the outcome focused and thinking around what's good enough, and really having that as the key focus. So thank you so much. All right, now we're moving on with the next presentation. Michael Sampson, and so Michael is joining us very early morning in Massachusetts. So thank you very much, Michael, for getting up so early. So Michael's going to enlighten us on the triple threats COVID-19 is presenting us with, and really focus on social protection's role with an eye firmly on different country contexts. So I'll pass over to you now, Michael. Thanks very much.
Thank you, Lisa. Over the next 20 minutes, I'm going to talk about the what, the why, and the how of how social protection can contribute to this coronavirus triple threat. Let me take a step back for a second and talk about for a minute the three types of interacting shocks that make up a crisis. First, you have the direct set of shocks, and then all the indirect consequences that result from this without a response. And then third, and very importantly, you have the shocks that result from our response. For example, a drought destroys crops and livestock. That defines the crisis, but this causes a loss of livelihoods and creates hunger. We might put in place shock responsive cash transfers to improve food security, but this creates inflation. Now, the reason I'm focusing on these three types of shocks is because if we analyze the first two, we can assess the cost of inaction. And if we focus on the third, we can assess the best way to respond. The coronavirus triple threat involves all three. It's a global public health shock of unprecedented impact in our lifetimes. And we've been talking about a lot of the indirect consequences, particularly the economic, but there are also other social and psychosocial and other consequences that are also important. But what I want to focus on in the next 15 minutes is the way the policy response accelerates. It brings from the future to the now and intensifies the social and economic and other impacts. I cannot think of another shock, another crisis in human history where so much of the immediate consequence has resulted from the way we're responding to the crisis. Around the world, most people still have not met the coronavirus, and yet they have been affected by this crisis more than any other global shock. Now, we saw a couple of minutes ago this pandemic curve, and this outlines the mainline policy response. If you've got a pandemic curve overwhelming the initial healthcare capacity, you want to do two things. You want to expand that healthcare capacity, and you want to flatten that pandemic curve. And that's been the mainline response. I'm not going to talk a lot about that mainline response today. I'm going to talk about how social protection can improve the equity and efficiency and effectiveness of that response. Now, that mainline response on its own might work relatively well in well-resourced countries, but in developing countries, we need a more contextual response. Healthcare is less universally accessible. People in developing countries have limited savings and inventories. They can't cope with an extended shutdown for a protracted period of time. And while if we have a lot of resources, we can focus on the health and economic trade-off. If we have to be very efficient, we're going to have to focus on the more complex relationships. And developing countries have been developing comprehensive social protection systems that can handle a more nuanced and comprehensive approach. You may have seen Ugo's famous map here. A few weeks ago, it highlighted big gaps in Africa and other regions of the world. Over the past few weeks, COVID-19 has been accelerating in Africa, but still we see a major gap, particularly in Africa, as well as in other countries. So what I'm going to focus on for the rest of the talk are how social protection approaches, both core responses and a more coherent approach, can strengthen the effectiveness of this mainline response. So I want to talk about three pillars, three timeframes. And the crisis has really redefined what we mean by immediate. I'm not talking about in the next few weeks, I'm talking about the next few days. And when I talk about short term, I'm talking about the next few weeks, and medium term, a month or perhaps two. That first pillar there represents the mainline response I just described, strengthening the public healthcare system and appropriate social distancing measures that flatten the curve. But just to make those equitable, particularly in developing countries, they require immediate core social protection interventions, ideally aligned to the mainline response. If we're strengthening the public health care system and people don't have access to it, we're increasing inequality. And if social distancing puts the economy in a coma, we have to provide life support. So what I'm going to talk about over the next 10 minutes are these core responses. Preemptive social health interventions, including preventive measures that need to be immediately complemented by supply-side investments to mitigate this epidemiological shock. A good example is Taiwan. It established a command center to coordinate different agencies. It moved to ramp up production of vital inputs, including face masks. It rolled out island-wide testing. It put in place case management and retesting. And very importantly, it cracked down on disinformation about the virus. The main social protection intervention Taiwan already had, universal health provision. But around the world, we see countries beginning to address this by eliminating user fees, eradicating bottlenecks to access. In Indonesia, the government contributed 3 trillion IDR to the National Health Insurance Scheme to cover contributions for 30 million non-salaried workers. We see Korea following with premium reductions, Thailand covering all COVID-related costs. But second, social protections provision function is necessary to moderate the livelihoods shocks. This has been the main response of governments globally in terms of unconditional cash transfers and, for the most part, formal labor market initiatives. We see countries scaling up existing cash transfer programs. South Africa is facing the challenge of reaching the informal sector adversely affected. Just increasing the value of the child support grant will reach most of the informal workers affected and as yet mostly unprotected by the existing measures. This graph here shows that more than 80% of South Africa's most vulnerable households, including most of those in the informal sector, would be reached by filling up the child support grant. We see Brazil's Bolsa Familia adding 1 million new beneficiaries, and Indonesia's PKH is looking for a similar increase this month. The Philippines is waiving all conditionalities. I've been asked a few questions. What do we do when our programs don't cover everyone who's affected? Listen to Voltaire. The best is the enemy of the good. We're not going to put in place in the next week a perfect response, and that's okay. We need to move quickly, even if that results in targeting errors. Multiplier effects will help the excluded households. We see evidence that households redistribute their benefits to correct these errors and improve equity. Monitor, monitor, monitor. Identify options to expand horizontally, relax eligibility criteria, delay exit from the programs. We've seen governments convert school meal programs to take-home rations, and in Bolivia, they put in place the Bona Familia program to replace the school meal program. How do you register people quickly? Use the existing registration systems and adapt them. The Cook Islands, the model in the Pacific, simply eliminated the application process. Move households from waiting list to receipt, like we see in Sri Lanka. Adopt other systems. South Africa has a public works system that is suspended. That payroll system can be used to provide unconditional cash transfers, as we see in some states in India. How can we leverage the existing delivery systems that are weak? More universal approaches simply sidestep these weaknesses. Can we put in place mechanisms to enable people who are sick to access their benefits by proxy? How can we deal with expectations? Be honest and be transparent, but I would not worry too much about raising people's expectations. Expectations of uncertainty and economic downturns will reinforce the contraction. if people are getting optimistic about the magnitudes of the benefits, that's going to strengthen the economic stimulus. Now, this can create a two-way street. Ensuring universal access to the healthcare system better enables testing and treatment, and this improves the efficiency of the overall public healthcare system. And these provision benefits that I've talked about also strengthen the effectiveness of social distancing. We've seen all around us how difficult it is to enforce stay-at-home orders. So much more difficult when people's livelihoods depend on leaving the home and they have no other benefits. These benefits will enable these systems, these mainline responses, to be more sustainable and more effective. Now, these core social protection benefits and programs might suffice in the short term, but in many developing countries, if the likely worst case scenario materializes and these kinds of measures are required for 12 months or 18 months or longer, we're going to need a more contextual response. We're going to need to look at the way these measures and the crisis are changing the way society operates. We'll be living in a new seclusion society, and we'll need to look at livelihoods, human capital investments, and ways to improve communications, behavioral change, and even change social norms. I want to talk for a few minutes about livelihoods. Much of the livelihoods and employment measures that we've seen emerge in the past few months focus on the formal labor market, but informal labor markets are dominating in developing countries. And we've seen supply chains working in most parts of the world, and demand stimulus depends on this adequate supply. But as this crisis becomes more protracted, we're going to see challenges in people surviving at home. In rich countries, people can work from home fairly well, but we're going to need a more adaptive response in developing countries. Developing countries have focused through social protection interventions to strengthen adaptive livelihoods. And we've seen in the past HIV and AIDS pandemic, South Africa integrating home-based care into its public works program. In the Ebola crisis, we saw Guinea, Liberia, and Sierra Leone put in place contact tracing teams. And in the current crisis, they're beginning to reactivate these as a public works measure and as a public health initiative. In fact, in the United States, the state of Massachusetts has been looking at the same model to improve their healthcare response and bolster employment. Similar issues arise for human capital. We've got an unprecedented number of children out of school because of the crisis. And this is not just an immediate human capital shock that will have persistent consequences. What happens when school ends and many of these children, because they've been disconnected from the schooling system for so long, they drop out of school? And many children depend on these school meals for their most nutritious, sometimes their only nutritious meal of the day. How can we put in place resilient human capital initiatives to tackle this problem? They're not going to be perfect, but Sierra Leone during the Ebola crisis used radios to create a schooling program that proved to be, yes, imperfect, not nearly as good as going to school, but a way to keep children connected to education. Liberia adopted a similar approach and included home education kits. But any kind of disruption, resilient human capital intervention needs to focus on equity. The poorest are the most vulnerable to these disruptions and the least likely to benefit from the initial responses. A well-intended but flawed design can exacerbate inequality. We need to focus on reaching the most excluded. There is a few issues with communications and behavioral change that social protection has worked with very effectively. Trust in authorities is vital for tackling a pandemic, and that's been in short supply in a number of countries. Taiwan provides a good model of daily press briefings. The country has the advantage of a vice president who's an epidemiologist, announcements and consistent information about hand washing, the danger of hoarding masks, and other key issues. South Africa was able to put in place an effective communications strategy in delivering its social grants, effective distancing there at the pay point in day 4 of the lockdown. But outside the pay point, the process was not so smooth. So it's not only a matter of thinking outside the box, it's thinking outside the pay point as well. These programs, comprehensive social protection programs, can strengthen behavioral change. One of the key areas that social protection has linked with in many countries is hand washing and other aspects of water and sanitation that are vitally important today. But these also require supply side investments to complement these efforts. And this crisis has made the returns to these investments more important than ever. What this crisis is going to do is change social norms in ways that we cannot fully anticipate. But if we do nothing, we will have no influence on this direction. One of the most confounding social norms that we see in social protection and everywhere is the tendency of stakeholders to work in silos. Perhaps never before has working together nationally and globally been more important. All these components are linked together and they require integrated and comprehensive responses. Crises can help change those behaviors that keep people from working together. Policymakers need to plan for both the best and worst case scenarios. We often think if we're prepared for the worst case, we'll be ready for the best case, but that doesn't necessarily happen. In the worst case scenario, Africa and many other developing countries are going to face horrendous shortages of ventilators if the pandemic peaks. And preparing for that is an important contingency. But in the best case scenario, perhaps the falling pandemic curve in the industrial countries will coincide with the rising pandemic curve in developing countries, and there'll be a global glut of ventilators. If countries have not prepared for that with ad hoc ICU training for healthcare staff, that opportunity will not be fully taken advantage of. We see civil society playing an important role motivating for these more comprehensive responses. In South Africa, over 100 economists, including many prominent ex-government officials, have signed an open letter to the government calling for a more comprehensive approach, including core and comprehensive social protection interventions to tackle this pandemic. This comprehensive approach also reinforces the mainline response. If we're providing households with better livelihoods, if we're keeping youth engaged in education, if we're strengthening the communications response, then we can have a more effective mainline response. People are more likely to stay at home if their livelihoods are addressed. What's standing in the way of delivering a better response? Attention gaps. Policymakers are, of course, concerned with the mainline response. Thinking about comprehensive social protection seems like a luxury. There are finance constraints. Developing countries don't have the same resources to provide trillions of dollars in deficit finance and monetary stimulus. And there is a gap in political will that's delaying the response. In spite of the compelling global examples, we still see policymakers who are hesitant in part because of concerns about the global response to unconventional approaches. Finance ministries and other key stakeholders in developing countries cannot allow this business as usual approach to reinforce a double standard, where developed countries do whatever it takes to tackle the crisis, but developing countries have to pay the price of inaction or inadequate action. One thing that can help here to tackle the evidence gaps are better models. We are looking at models that focus on health and look at demand side elements of the crisis. They focus on macro dimensions, but policymakers need household-focused micro models that can assess livelihoods, human capital, social, and other impacts. Let me conclude with 5 key points. What I've talked about in the past 20 minutes are complex, comprehensive social protection responses that can improve the overall coherence of the response, but they should not delay the immediate, appropriate mainline response. Core social protection interventions should align as closely as possible with the schedule for mainline responses. If you're shutting down the economy and putting people's livelihoods at risk, you need to respond immediately to tackle the resulting vulnerabilities. But over time, more comprehensive approaches can reduce both the short-term and long-term costs and improve the overall effectiveness of the response. We need credible, rapid response evidence, including from household-based micro models, to overcome resistance in finance ministries, to inform intersectoral cooperation, to reduce these social and economic costs, and to improve the likelihood of success. In the worst case scenario, if these responses require multiple years of successive phases, this comprehensive social protection in the first phase can lower the social economic costs and tackle the emerging vulnerabilities of this new seclusion society. In our lifetimes, we have not yet been presented with such an urgent opportunity to invest our efforts, our skills, and our resources in a response with such vital social returns. Thank you.
Brilliant. Thank you so much, Michael. There's so much useful information in there. Great advice on some of the tricky issues in implementation in these COVID-19 times. And I love the message to keep a focus on the most excluded. Thank you so much. Now, I would like to pass to our discussant, Christoph, now. He'll discuss what we've just heard from Valentina and Michael, and possibly pose some of his own questions and offer some reflections. I imagine drawing on some of his past work on the on Spanish flu and Ebola. So thanks very much, Chris.
Yeah, thank you very much, Lisa, and thank you very much, Valentina and Samson, for the great presentations. I think you offered a wide range of options and examples how social protection can respond to the current crisis. So I like both presentations a lot. What I like most, like from Valentina's presentation, was really that this kind of very short-term social protection response, like to stabilize the current social protection programs, especially doing contingent proofing of all operations of current social protection programs seems to be very important and should and could be done immediately. I really like this kind of examples, like on the school meal programs, that they can just do home delivery or school meal to go approaches, as in India and Liberia, we already have seen them. And with regards to public works programs, we also have seen that they can be adapted maybe to other types of work. For example, in the Philippines, we have seen an adaptation that people can disinfect their houses or improve their sanitation systems, and declared as a kind of public works activity. And of course, besides this kind of resilience or improving activities, a scale-up of social protection programs should be conducted wherever possible. I totally agree. So especially vertical and horizontal expansion, like to increase the coverage and also the adequacy. What I would like to suggest is also kind of when it comes to the information or how these kind of adaptation and scale up should be done, I would suggest a triangulation of information. Of course, first we should use information about current beneficiaries that are already in existing social protection programs. Second, we also should use, as also mentioned by Valentina, we should use information from other programs or sectors, like for example, the tech sector, on non-beneficiaries that are probably very vulnerable. And thirdly, importantly, I also would like to highlight that we should, of course, include information about the spread of the virus. So especially the number of cases, deaths, and of course, where the virus hit the countries strongest, and also who is affected, in which kind of region, and so on. I know this is very challenging for lower income and low income countries, but we also have to, and this is maybe like from the public health side, we have to improve, of course, and increase the number of tests. Some of the countries, especially that went through the Ebola crisis, they have a good information system already in place. They gained a lot of experience, so probably we can learn from them how they have collected a lot of information about Ebola and what kind of system they have in place. For example, mobile test teams could travel through the countries and do representative samples of tests in order to improve this kind of information base. And collecting information from all these three of sources, it would be very helpful when it comes to scale up and adapt current social protection programs. It will not be perfect, but we know from past pandemics that there will be spatial hotspots also of the virus, and we should consider this kind of information, and especially poorer areas where we have a high population density, low access to clean water, low access to healthcare should be considered as well. So this kind of information should be considered as well when it comes to scale up of existing social protection programs or to create new programs and emergency programs and so on. Current examples, for example, I would like to highlight. We have, for example, in Jordan, the government recently announced to use the bread subsidy registration database that they have in hand and combine this information with information that is collected on COVID-19 and those that are affected by COVID-19 or infected by COVID-19 and are also part of the bread subsidy registration database will receive emergency cash transfer programs. So here you can see a kind of combination of different information sources. Also a good example is in Tunisia, where the households use, the government is using households that are registered with low health care cards and that are not covered by any other social system program and that are also included in the informal sector. So here you can see the Tunisian government tries to identify especially those that are probably vulnerable to shocks and that are not covered by any kind of social assistance program. And in order to close also this missing middle that was described by Valentina, and those households also should receive a cash transfer program. And yeah, using all these different information really would help up to scale up existing programs. But of course, the question remains, and I would like to pass these questions also to the presenters. What about countries that only have inadequate social protection systems and programs in place? And the question is how to support especially these countries. And I also saw a question in the chat, what about countries where many or a high share of the population depend on global remittances? Yeah, these kind of questions maybe can be addressed by Valentina and Samson. What I liked also a lot is like that Samson focused a lot on the importance of comprehensive social protection programs, in particular in the medium to long term. This I can only underline that this is very important, that because I also agree that these kind of crises, it changed the risk structure and also the vulnerabilities, in particular in low-income countries for many people. And we don't know how long this kind of risk structures will be changed. So we know that markets probably will not work properly anymore for a longer time because of social distancing, interruption of value chains, and so on. The health systems are also very weak and probably can collapse, especially in low-income countries. So when it comes to regular medical treatments after an accident, for example, or after a malaria case, it will be difficult for those affected to seek treatment. We see that the education systems do not work currently, so there's risk of losing human capital. And of course, many institutions, also ministries, are currently overwhelmed in these countries. And this, of course, increases the risk of state fragility and also political instability. And taking all these into account, it would be, of course, this kind of extraordinary crisis probably needs a more extraordinary answer also with regards to social protection interventions, and to have some more comprehensive social protection interventions in the medium to long term. And but of course, here maybe also a question to Michael would be what about countries where we know, especially also low-income countries that have low delivery capacities, how these kind of countries can implement such comprehensive approaches? You have highlighted these different kind of constraints, attention constraints, also finance constraints. Do you have any idea how to overcome, especially maybe the finance constraints? Do we need a kind of a global global funding structure in order to help especially these countries? And yeah, as Lisa mentioned, I also was involved in the past in a research project, a big research project on impacts, social and economic impacts of the Spanish flu that went around the world during the 1920s. And there it's very interesting that, and from some of the case studies we have, so these are microeconomic case studies with long time series data, we really can see that comprehensive social protection programs or settings were very effective and helpful in these times. So for example, in Sweden had implemented in these days a kind of poor relief assistance program, and in order to cope with the Spanish flu. And this kind of program combines the delivery of different assets, food, also kind of training, medical care, and also sometimes housing in poor houses. And it was a kind of comprehensive package to stabilize the livelihoods of those that were especially affected by the Spanish flu in the past. And from empirical analysis, we can see that especially regions where these poor relief assistance programs were in place and also were heavily used, these regions so this kind of program contributed substantially to the economic stabilizations of these highly affected regions in the medium to long term. So we can see these kind of medium to long term effects with regards to Sweden. What was also interesting, back in the days, there was some kind of self-targeting in place. So a lot of people could come to official poor houses and other institutions in order to register for this kind of relief assistance program. Maybe this is also an option for the current situation. And what I would also like to highlight from the past, like on the research on past pandemics, is that maybe this is also similar regarding COVID-19. It depends. We have to still to do more research on that. Is that those that have been infected for example, by the Spanish flu and survived, some of them had long life health consequences, negative health consequences, and were also labor constrained. And probably we see similar kind of effects also with regards to COVID-19. It depends on the pre-existing health conditions, especially of larger parts of the population in low-income countries. And so it might be that we already have to think of a larger share of people that need to be covered by some type of social protection instruments in the long term because of the negative health effects of the current pandemic. Yeah, that's my comments from my side. Thank you.
Great, thank you so much, Christoph. That was great. So Christoph has raised a few things which I'm also seeing, I guess, showing up in a number of the questions coming through, and the questions are coming through thick and fast. Maybe we should start with something which I have seen quite a bit of interest in around what do we do when there is inadequate social protection systems, and I think both presenters sort of touched on this in their presentation. I know definitely in the region that DFAT works, in the Pacific, we've got Papua New Guinea, Solomon Islands, Vanuatu, then in the Mekong area, Laos, don't have social protection systems at all. What then? What have we seen sort of work in this space? If Valentina or Michael, you might like to talk to that a little bit more to start with.
Yes. Just very quickly on my side, there's going to be a webinar which looks into this exactly, and part of the idea here is how other actors, such as, for example, humanitarian actors, can be playing a role in this, but not in the usual fashion of just going ahead with programs that aren't coordinated with government, but actually leveraging even the little that there might be in terms of, for example, staff and capacity, working alongside people who know communities quite well, who are government staff, building up their capacity kind of in terms of showing how humanitarian registration and targeting systems work, and thinking from the beginning of the action, how might this transition in the medium term back to government, how could this set the foundation of a future social protection program? So in terms of the transfer value, in terms of the even possibly handing over data back to government. So in that case, making sure that your informed consent is clearly thought through from the start from that perspective. So there's a lot that can be done in terms of better coordinating, better working with the humanitarian sector with that medium term objective in mind. And there's going to be a webinar on this. I think it's Thursday. Over to Michael.
Yeah, thank you. I think the key here is not to worry too much about putting in place the best system. The priority is an immediate system. For countries that have some kind of functioning mechanism, scaling that up is the best place to start. And if countries have nothing, as Valentina pointed out, civil society can help expand capacity and look at existing mechanisms for delivery, even if they're not social protection mechanisms. Yeah. If there are other programs that aim to reach the vulnerable, use those lists. And universal provision here has never been more indicated. There's been more talk about basic income grants and universal cash transfers, which sidestep most of the barriers to immediate rollout. So looking at universalism here is probably the best step, because the countries that have no social protection programs, they probably need that the most.
Just a quick add-on to what Michael said, an example from India was, beyond also starting to work with existing social protection systems, and some states have taken bigger steps in that direction, such as Kerala and Uttar Pradesh, for example, but also leveraging financial inclusion programs. They had bank account detail from existing financial inclusion programs for over 200 million women, and that enabled an immediate vertical transfer to an increase top up amount to those women by those bank accounts. So leveraging also anything beyond the social protection sector that might be useful. We've talked about Chamber of Commerce data for informal registry, people who work in the informal sector. Cape Verde has started doing that. Other countries have started just using other channels to be doing this.
Yeah, great. And I mean, what you said there, Michael, too, links into what Christoph also mentioned around financing, and a number of the questions are also that are coming in are also talking about financial constraints. I mean, there's a global economic meltdown already. Developing countries were finding it difficult to fund social protection. This makes it even more difficult. What to do in that space when ministries of finance are saying, like, look, we were stretched, we're even more stretched, and now we need to do universal social protection?
Yes, I mean, priorities have changed, and the business as usual constraints on finance ministries do not apply to developed countries. They should not apply, although they're harder to ignore for developing countries. Still, the biggest constraint we've seen has not really been financial, but the political will to use the financial resources to expand deficit financing. In developed countries, we're hearing a lot, and we heard in the last webinar about helicopter money. That's monetary expansion. It's one time, but it is a source of resources that most countries can tap into. But most of all, we need global leadership. There has never been a higher return investment for global development partners.
Yep.
Yes,
great.
There's going to be a webinar on financing specifically, and also we need to think about the short-term financing needs now, and in the longer term, how might we want to set up a system so that we're ready for something like this or something similar. And there's a lot of best practice already from countries that have taken steps in terms of incorporating disaster risk financing into their social protection discourse.
Yep, great. Thanks, everybody. We're seeing a number of questions coming in on registration. So a desire for some more examples of implementation of new platforms to register non-beneficiaries into programs. What are the core elements must they have to be effective? Options for remote self-registration, though, when you've got difficulties with scarcities of mobile phones. How do we ensure we don't have double registration when we're doing this? Basically, any further information on general the remote identification, selection, registration of beneficiaries.
If I could quickly start on that. So on the registration, let's remember also that we're monitoring what countries are doing, and a lot of what we're seeing in countries is big declarations, we'll be doing this, and then setbacks when they realize that what they said they would do is not really feasible. And that even happened in the US, where it was, we're going to be doing a universal basic income. Then actually the practicality of putting that in practice was complicated. They ended up going through tax data to be able to reach formal sector people who had been paying taxes and giving money to them, and those without bank accounts might not receive money for another 4 months because of this process. But let's just think through the issue. There's some background things that we want our registration to be very swift, easy, simple. So loads of countries have been getting rid of documentation requirements, having reduced forms, collecting minimal data. This is not a time where we have to do a comprehensive assessment of your situation in order to be paying. A lot of countries, the core principle is pay now, verify later. And that's something that I would just drum in general as a concept. Then there's kind of, having said that, there's the question of, so how do you actually register people? And of course, the best case scenario is you've already got information on those people and you can start from there. But of course, many countries don't have that. If you're looking into that scenario, you might have some good, strong social registry. You might have want to start from there. There's a DFAT document that goes into a lot of the details of what you need to look out for, what are the warning signals to be starting from existing data. But again, countries that have been able to expand horizontally very fast, including, for example, BISP in Pakistan is using its national socioeconomic registry to be expanding, but they're also aware that that's not enough, because existing data might be out of date. It might not give you a sense of who is in need now. So even BISP in Pakistan is expanding to further households beyond their existing registry. So what are the options to be doing that? You could either go with a kind of a census survey door to door, and we've said that's problematic at this stage. And if that is an option that seems to be the only one, just be really careful to think through how not to kind of spread contagion with that. But the other option is to go through more on-demand systems. So opening countries that don't have on-demand systems right now, which are a lot of low middle income countries do not have on-demand systems, or even if they do, it's an on-demand system by local offices. And that might also be a source of contagion. So if we're thinking online, which is obviously the ideal solution, countries where that has been an option have been doing that. So simple online platforms for registering, applications where people can input very minimal data, and that data, if they have the capacity, for example, countries with ID systems are in a stronger place because they can use that ID as authentication, linking that data to other government databases, maybe complementing that data. And even, I mean, we're talking about even countries where internet penetration or people having the literacy to be able to do so is an issue. They've been using civil society organizations, existing community structures to support that process. So it's not impossible. There's also the option of having desks going to communities and then very kind of regulating fluxes, and countries have been doing that. And that is very much the humanitarian approach, which again, this doesn't have to happen via the social protection sector. We can humanitarians have been doing registrations in these types of contexts for ages, and we can learn a lot from them. So I hope that webinar will also go into more details on these aspects. Over, thank you.
Yeah, let me just reinforce that. This is an area where the World Food Program and UNICEF and other international organizations have enormous experience. And looking outside the specific social protection toolkit to these humanitarian responses, we have a lot to learn from the lessons of previous supply side crises.
Yeah.
Just a comment from my side, this also could be combined with, as I mentioned during my short discussion, like when you send mobile teams to different regions of the country in order to do extensive testing on COVID, you also could combine this with some kind of registration or like moving desks where people can come and register. So this would be also kind of option to combine both approaches. Yeah.
Great, thanks everybody. Kind of linked to what we've been talking about with identification and registration, I guess is the other end is monitoring and evaluation. I know it's something that we've been grappling with here when a lot of the human resources have left the country within country governments, or people are working from home, and so there's a question here asking, in terms of creating credible evidence of rapid response interventions, especially in terms of impacts, what kind of tools and methods could be used given the constraints on collecting data face-to-face at the moment? Any wise words on that?
Well, one tool obviously that could be helpful, although it's still inadequately available in many developing countries, is the smartphone. The smartphone can help with adaptive livelihoods. It can help with disruption resilient human capital development. It can help us monitor these programs. It can help us expand access. Can we look at options for dramatically expanding access to information and communication technologies through smartphones and through the broadband access, the Wi-Fi access, cellular access, and then use these tools for cross-cutting purposes, not just to deliver programs, but to provide more flexible and developmental adaptive responses. If this crisis ends in a few weeks or a few months, that's not such a big issue, but in a very likely scenario of this going on for a long time, we're going to need to think more proactively about the resources we're providing.
Thanks, everybody. Now, linking to what Valentina said before about pay now, verify later, I think that may stick in a lot of people's minds. I have a question here around, I guess, to what extent you could apply that principle to payments. And so to what extent do you think financial transfer regulations around know your customer, for example, need to be relaxed to allow direct electronic transfers? And what are the risks of this, but can they be mitigated?
It's a tough one. It's a tough one. There are experiences of doing this to some extent in the past. The Philippines, for example, in response to typhoon, kind of there was some changes in legislation to be able to meet know your customer requirements at a lower threshold. Again, the reason, for example, that Thailand, to me, I mean, from my limited understanding, was able to register 22 million informal workers and possibly get out payments very fast is because of the strength of the underlying ID system in terms of authentication. So again, that helps to meet that know your customer requirement for getting payments out. So where that is not in place, where there isn't a robust payment system is not in place with especially let's think about even situations where it's government delivering and humanitarians putting in funding. If some of the just traceability of those payments, fiduciary risks are not addressed, that will be an issue. So these are all kind of nitty-gritty topics that each country will have to be discussing. There's some existing documentation that can help with that, and I in the Q&A when we write up the answers, maybe I can just provide links to some useful resources on this.
Yeah, great, Valentina. I think we're going to be very busy with writing up that Q&A because we've got so many questions here, and we've only got 1 minute left of the webinar. But actually, we'll just have maybe one last question, perhaps. We've been talking mostly about social assistance, and I know, I mean, social insurance was raised, but we have a question around what strategies should be applied for social insurance, contributory programs. Any more advice on the contributory side and what we could do right now?
There's going to be a webinar on that as well. We're going to have a panelist from OECD who they've written a really useful policy brief looking at what a lot of especially OECD countries have been doing on this, but also other countries. We'll also hopefully have a panelist from ILO who's been looking a lot at this, especially in terms of expansion to non-standard workers. So do watch that webinar. I think that would be my fastest response.
Yeah, and we also have seen some reaction there, no? That some of the contributions have been waived in many countries. So with regards to social insurance schemes, and yeah, of course, you also what we also have discussed or shown that it would be maybe useful to link, of course, non-contributory with contributory schemes. So this would be maybe also an option.
Yeah, and also, I mean, we call them contributory, but actually, in many cases, countries are now financing them by additional just tax financing. So it's also about filling in the financing gap.
Yeah.
Yeah, great. So thank you all. We are going to have to draw this to a close. It's been such a rich discussion, and I'm looking at all the questions streaming in at the moment, and I think we could stay here for another 4 hours and still be going. But we will answer all of the questions. But just a few things before we close up. So just, yeah, to repeat, we definitely will be making, I guess, the answers to the questions available through sp.org. Please do remember that you can join the online community dedicated to this initiative and keep updated about the upcoming webinars. As Valentina says, there's going to be a webinar on nearly to answer nearly all of your questions in depth. And finally, also remember to register for the next two. So there's two coming up that are already up there that you can register to right now. So I think that's it from us. I want to very much thank the presenters and discussant, Michael, Valentina, and Christoph. Thank you very much to socialprotection.org for putting this together. They're putting together doing rapid fire webinar series, and it's a lot of work, and we really appreciate it. Thank you to everybody who has joined. This is definitely the best attended webinar I have been involved with over the years. And I wish you all luck as you take forward social protection responses in your countries. This is a really difficult time. But thank you very much.
Thank you.
Thank you, Lisa.
Thank you.
Bye.
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 Oh, cool.